Okay, so the brand new 2026 diabetes guidelines have dropped. But here's the thing. If you're looking for one single, massive, headline-grabbing change, you're going to miss the real story. The update isn't about one big announcement. It's a huge shift in the entire philosophy of diabetes care. And we're going to break down exactly what that means. This quote, man, it just nails it. It really captures the heart of the whole thing. This isn't about some flashy new drug or a different target number. It's what the source calls a quiet re-engineering of the entire approach. It's making care more personal, more driven by technology, and more integrated than it has ever been before.
So that's the million-dollar question, right? What in the world does this quiet re-engineering actually look like when you're in the clinic? We're going to dig into that by looking at three major themes that really stand out in these new guidelines.
First up is what I'd call a true revolution in how we even think about care. For decades, the main fight in diabetes was all about one thing, that blood sugar number. But these new guidelines are expanding the battlefield in a huge way, moving far, far beyond just glucose.
And this slide just lays it out so perfectly. Think about it. Before, it was all glucose-centric. The goal was to get that one number under control. But now, the approach is system-centric. It's finally recognizing that diabetes doesn't just affect your blood, it affects your entire body. And the treatment has to reflect that complex reality.
And this is what system-centric means in the real world. I mean, look at this. The diabetes clinic is basically turning into a multi-organ clinic. We're not just talking about blood sugar anymore. The guidelines now push for aggressive, layered protection for the kidneys, proactive prevention and treatment for heart failure, a brand new focus on liver disease, and even getting ahead of things like bone health. It's a whole new ballgame.
All right, let's jump into theme number 2, because this one really builds on that idea. And honestly, this might be the biggest, most hands-on change for so many patients and doctors. Technology is no longer a cool, nice-to-have feature. It's now a core part of standard care.
I mean, just let that statement sink in for a second. For years and years, things like glucose monitors and insulin pumps were kind of seen as these advanced niche tools, right? For a select few. Not anymore. The guidelines are making it crystal clear. Technology is the new baseline. It's the default.
So how is all this tech actually being woven into care? Well, it's happening at every single step. First, you anticipate the disease, using continuous glucose monitors, or CGMs, even before there are symptoms. Then you monitor pretty much everyone with a CGM, not just people on insulin. And finally, you automate the treatment itself, with automated insulin delivery systems becoming the go-to preferred therapy. It's not an add-on, it's a total tech takeover.
And that brings us to our third big theme. And I think this one might just be the most important one of all. The guidelines are finally, officially, recognizing that diabetes isn't just a biological problem, it's about the whole person.
Now, to really get this shift, we got to wrap our heads around this word, biopsychosocial. It sounds complicated, but the idea is actually pretty simple. It just means you can't only look at the biology, the genetics, and the cells. You also have to look at the psychology, things like mood and stress, and the social stuff, like a person's family life, their culture, their financial situation. They are all connected. And just look at what this means when the rubber hits the road. We're talking mandatory mental health screening for things like anxiety. Care partners and social support are now officially part of the plan. There are new screenings for sleep health. And this is huge. The guidelines explicitly say that a patient's financial situation has to be considered. This is about treating a human being, not just a set of symptoms.
So, we've got this incredible new picture, right? A systemic view of the body, tech as the new standard, and a deep focus on the whole person. It sounds amazing. But, and there is a but, this brings us to the final, and maybe the toughest piece of the puzzle.
And let's be super clear about this. This new blueprint for diabetes care, it's fantastic. It is absolutely the gold standard, and it represents a massive leap forward in how we think about this disease. It's what every single patient deserves.
But here's the uncomfortable truth. This perfect plan kind of assumes that everyone has access to the best technology, that doctors have the time for these deep consultations, and that the whole healthcare system is set up to support it. And we all know that's just not the reality for everyone everywhere. And so, that's where we're left. We end on this massive question. The guidelines have shown us the mountaintop, the ideal destination. But the real work, the hardest work, it starts right now. How do we build the bridges to close that gap between this amazing blueprint and the messy, complex reality on the ground for every single patient? That, right there, is the challenge ahead.